Hello, good morning.
Good morning, doctor.
I am Dr. Bishash. I am a doctor of this clinic. May I confirm your name and please?
Yes, doctor. I am the Scarlett Johansson, 52 years of age.
Very nice to meet you, Mrs. How can I address you?
Okay, you can call me Scarlett.
Okay, Mrs. Scarlett, I have got a letter from your GP saying that you have kissing for last 10 months. Is it right?
Yes, doctor.
So I'm going to take detailed history about your condition and all the information during your discussion will be remain confidential. So is that okay for you?
Yes, doctor. It's completely okay.
So can you please tell me that what is happening with you?
Well, doctor, actually, I was quite all right 1 year back, but since the last 10 months, doctor, I think I have been facing some problem with itching. At first, I did not give so much importance to it, but as the days are progressing, I think that it's getting more and more irritating, doctor, nowadays, and even I don't feel very much comfortable even at work also, doctor. So that's really embarrassing me.
I'm sorry to hear that. Can you please say me that where do you feel the easy?
Doctor, I think that it's more or less throughout my whole body.
And did it start at all over your body or any part, a specific part?
No, doctor, I cannot specify any part, doctor.
You said it is increasing.
Yes, doctor.
And can you please tell me that when do you feel the itching?
When, doctor, I cannot specify, doctor, when I think it's, but when I go to some heat, I think, or sometime some bath, okay, I think that makes it worse, doctor. Some warm bath, I think that makes it worse.
Can you tell me that did it uh, any specific part you feel this like any more in the body or more in the arms like that?
Any, sorry?
Any specific part of the body?
No, doctor, I cannot specify, doctor.
Okay. And have you noticed any changes in your skin during this time?
No, not specifically.
Any redness?
Uh,
Any
no, doctor,
rash?
but some people tell that I have going a bit reddish day by day.
Okay. And have you noticed any changes in skin, like any abnormal skin changes, any thickening of the skin or anything like that?
No, doctor.
Okay. And you have this. You said that you have been informed that you are getting raped. For how long you?
For how long? What?
You said that people said that you have.
Oh, okay, okay, doctor. I think recently my relatives are telling me that I am getting a bit reddish complexion.
And associated with this, do you have any other complaints like any problem with
Doctor, what is the thing that I have some joint pain, doctor? That's present for around the last 2 years.
where is the pain?
Doctor, I think it's a more in the heels, doctor.
Okay. And when do you feel the pain more? At the daytime or at the night time?
No, doctor, I cannot just specify, doctor, but when it happens, it gets red, swollen. Okay, so it can be a bit irritating, doctor. And I think during the last 2 years, I have faced it 6 to 7 times, doctor.
Did you seek any medical attention for that?
I seek medical attention for the first time, but the doctor actually gave me some over-the-counter, some painkillers at that moment. But later on, I didn't follow up. Okay, I whenever the pain is more severe, I take that. Sometimes it works, sometimes it doesn't work. It goes away on its own. So that's how my life is going on.
Okay, and you for your reason, you said that red, any warm water increase this. Have you noticed anything that increase this?
No, doctor.
Anything that decrease this?
No, doctor, I cannot just specify actually. That's that medications that I take, some painkillers, usually they act well.
Have you noticed that any specific cosmetics, any specific clothes that is causing this or that causes the problem?
No, doctor.
And I am going to ask you a few personal questions.
Okay.
Do you have any headache?
Yes, doctor. Sometimes I feel headache, some all over my head. Okay. So that's also present for the last 6 or 7 months. So sometimes it's such so severe that I think that my vision is also compromised. I think there is some blurring of visions as well at moments. So that's also bothering a bit.
And do you feel any headache in the morning?
Nothing like that, doctor.
Any coughing or any straining increases the headache? Have you noticed anything?
No, 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 no.
Okay. And you said that you have also noticed changes in your eyes, that is, changes with your vision. Have you noticed any changes in
Yeah,
the color of your eyes? Redness or any yellowish?
yeah, yeah. Sometimes, doctor, some redness, doctor.
And do you feel any pain in your eyes?
No,
Okay. Have you ever noticed that anything coming out of your eyes, any pus or any abnormal discharge?
no, 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 doctor.
Do you have any other reaction here in your body?
No,
Okay. And do you get flush anytime? Have you noticed anything?
no.
Okay. How about your appetite
It's quite well, doctor.
and your weight? Have you noticed any changes in your weight?
More or less same.
Have you noticed any changes in the way their preferences, any hot or cold preferences?
No, doctor, nothing specific.
Do you have any cough,
No,
any shortness of breath,
no,
any racing or pacing of your heart,
no, doctor.
any tummy pain?
No,
How about your bowel habit?
you're quite well, doctor.
And
Bowel habit is quite well, doctor, but sometimes I have some tummy pain.
for how long?
I think during the last 8 months, I had this type of tummy pain 3 or 4 times, and at the same time, my tummy also got swollen up.
Okay. Have you sought any medical attention for that?
No, doctor. Actually, I live in a quite remote area, so this time I have come to you after quite hammering by my children.
I'm sorry for that. And have you noticed that for how long it persists?
Uh, Usually, I think 1 to 2 days, doctor.
Okay. Have you noticed any changes in your water work?
No, nothing specific.
And do you have any other joint pain except in your ankle?
No,
Have you noticed any changes in any with your power in your limbs, like any weakness at the side of your body?
not weakness, doctor. But you told about limbs. I must say that in the 3 months back, I suddenly one day I felt that there was some my swollen my left leg got swollen up. It was a bit painful as well.
I'm sorry for that. Do you have any problem with your clothing? Have you noticed anything?
I just don't know, doctor. That's what happened to me. I'm just telling to you.
Okay, that is not a problem. Do you have any past medical condition or any other disease in the past?
No, just I told that I had some joint pain. That's what. That's all.
May I know that do you take any medication,
No,
any over-the-counter medication or any herbal products?
doctor. When I told you that when this joint pain increases, I take some ibuprofen at times.
Okay. Do you have any allergy to any medication?
No,
Okay. And have you noticed any lumps or bumps anywhere in your body?
No, doctor.
Any of your family member have this type of condition?
No, doctor. But as far as I know, that my mother had some blood disorders.
Are you aware of that? What type of disease she had?
No, I don't know about the details of it.
That is not a problem. Is it okay if I ask you a few personal questions?
Of course.
Do you smoke cigarette?
Yes, doctor.
How many sticks and for how long?
Doctor, actually, it's quite a long time, around 15 sticks for the last 25 years.
Actually, I'm thinking that this condition is related to your smoking habit. So I would like to stop you, recommend you stop smoking. And if you need help, I can refer you to the smoking cessation clinic.
Okay, doctor.
Do you drink alcohol?
No, doctor.
May I know that what do you do for living?
Doctor, I live. I'm a homemaker, doctor.
And do you think that you need any social support or any other support from us?
No, doctor. I don't think anything specific is needed.
And do you drive?
Yes, doctor.
So I would like to recommend you stop driving until you are sure that what is happening with you.
Okay, doctor.
Okay. And do you have any history of recent travel outside the country?
No, doctor.
May I know about your menstrual history, though it is very personal, but I need to know.
Oh, it's all right.
May I know that what is your age of last cycle?
8 years, doctor.
Do you take any medication for birth control?
Sorry.
Any birth control pill or medication are you taking?
No, not no, doctor.
May I know that what is your concern?
Doctor, what's going on, doctor?
Uh, I have taken your history. I need to examine you. Will it be okay for you now? So that I can give you the best explanation.
Okay.
So I need to examine the hand for any rheumatological condition,
No rheumatological condition.
any clubbing,
No clubbing.
pulse,
Pulse 72 beats per minute regular.
any skin rash,
No.
then ice for any conjunctival injection,
No.
any redness,
Some redness in the left eye.
then I would look into the mouth, any
Rhetoric face.
rhetoric face, okay. And after that, I will go for the abdomen or any hepatomegaly or splenomegaly.
Yeah. Hepatomegaly present.
Okay. Then any rhinomegaly,
Not present.
any ascites.
Yes, asset is present.
Okay. And after that, I will go for the legs for any peripheral edema.
Okay. No edema.
I need to measure her pulse and urine deficit test.
Yeah, I told you it's quite normal.
Okay. So as I have taken your history and I have examined you, I think that you have a condition called polycythemia. Rubra. Have you ever heard of it?
No, doctor. What is it, doctor?
If, I'm sorry to say that it is actually a certain type of disorder in the blood where blood cells are increased abnormally. So that having this condition, and also this has resulted in your ankle pain. I need to run some blood test and some imaging test also. And after that, I can give you the best explanation of what is happening with you.
Okay, doctor. Okay.
Do you have any question for me?
No, doctor. Actually, that's Will I be treated well, doctor? Shall I be cured?
At this point, I am not quite sure that what is happening with you, but if it is the condition I am thinking of, then it is likely to be controlled with medication. But you will need some frequent follow up with us.
Okay, doctor. Okay, thank you. Time is up, I guess.
Time of 5 minutes back.
Okay. Okay. So, what do you think the case is?
For this lady, I think this is a case of polycythemia rubra, and I couldn't find any other specific causes except smoking.
Smoking can be a cause of secondary, but he has family history, so I think that can also be pointing here.
Yes.
Okay. So you actually didn't find any cause of secondary polycythemia.
I
There
tried to
was no
find out.
renomegaly. Oh yeah, yeah, that was all right. So polycythemia rubra vera, it's not necessarily it's a primary one. Polycythemia rubra vera. Am I right?
Yeah.
Okay. So that's very good. And so can you please tell me, considering his her age, can you tell me of some other DDs in this patient?
Then this can be a manifestation of some erythropoietin producing tumor, like a tumor in the kidney, then tumor in the liver.
Okay.
This is the far I cannot remember much.
Okay, no, no. I am telling about some DDs of this type of itching.
Okay, for itching, this can also present with as a case of chronic liver disease, then primary biliary cirrhosis.
Yes,
Like,
that's very important. An IBD associated
then
PSC.
can be can present with hypothyroidism,
Yes, thyroid problems, liver problems, kidney
diabetes mellitus,
problems.
diabetes
Yes,
mellitus.
diabetic mellitus. I think Addison's maybe not Addison's that much specific, but IDA can also be, I think, presented with itching. I think
Yes, I did.
rarely.
Yes.
Okay, so this should be the disease, and specifically for patient's purpose, TBC can be very important. I guess. Okay, so what investigation would you like to do in this patient?
For this lady, I will go for the routine blood test like complete blood count to see anemia or polycythemia, then white blood cell count level, and also the thrombocyte count level. In this case, all blood cell line are suspected to be increased. Then ESR, which should be low. Then inflammatory markers like CRP, and after that, liver function test, renal function test, urine for routine examination. Then
Mm.
peripheral blood film, and then some special blood test like for ZAC2 mutation. Then imaging test like ultrasonogram of the abdomen. Then I may
Well, can you please
for
tell
the
me of two specific tests? You are telling everything. You have told quite good. Just serum uric acid and ultrasound. That's all right. Can you please tell me how you can be confirmed about PRV, polycythemia rubra vera?
okay. For this, I can go for blood for ZAC2 mutation and bone marrow analysis.
Okay, I don't think that's needed. Okay, bone marrow analysis. I don't think that's needed. Just go for Janus kinase 2 mutation and EPO level, serum erythropoietin level. If there is Janus kinase 2 mutation and erythropoietin level is low, then it confirms PRV. Okay.
Okay.
Usually, bone marrow is not needed in polycythemia. Is it clear?
Okay.
Okay. So and just I guess some another thing. The ultrasonogram is important to rule out any hepatosplenomegaly, but I think pulse oximetry should also be included in your investigation. Okay,
Yes.
so that by chance you have ruled out chest causes, renal causes. Okay, but there is some more things like cerebral cause, and sometimes what we found, sometimes we find in words, sometimes heart causes like even PDA. can be present with secondary polycythemia or some Eisenmenger syndromes. Okay, so these can also be important. Okay, so how would you like to treat the patient?
Treatment is a multidisciplinary approach. First, I will educate and counsel the patient. Then some non-pharmacological managements like smoking cessation, alcohol cessation, maintenance of hydration status, then
Mm,
involvement of the hematologist, and
mm,
involvement of the occupational health therapist, involvement of
mm,
specialist nurse, involvement of the GP. The pharmacological management comes with like prescribing aspirin to prevent abnormal clotting, then uh, uh, going for the hydroxyurea to suppress the excessive RBC production,
okay.
and that needed some
Any specific
chemotherapeutic
methods?
uh, for yes for exact mutation tyrosine kinase inhibitors.
Okay,
For,
have you told venesection?
sorry,
Venesection.
oh, I forgot the venesection. Yes, it is an important one.
Yeah, venesection is very important. Okay, okay. So I think that's the case. Would you like to add anything?
No.
Okay, so you can stop recording.